Hello, everybody. Welcome to today's Facebook Live at 4. I'm super excited because today I have Kelly Wilhite here with me, and she's going to be talking all about SIBO. Now, this is something that you guys had asked to see more of and wanted more information on. And if you remember from, I don't know, a few months ago, Kelly and I did some IBS videos. She did an amazing presentation in IBS Masterclass. If you haven't watched that, you can find it on my website, carriesmith.com. And so I invited her back today to talk all about SIBO because that is her area of specialty, and I am super excited to have Kelly here with us. So what I'm going to do is turn it over to Kelly here in a minute, and she is going to talk to us about SIBO. She's prepared a presentation. She's going to be sharing her screen. She's got slides, all the good stuff. So thank you, Kelly, for being here. Ladies, if you have a question, I see some of you are jumping on, so if you have questions, be sure to comment them in the comment box. Say hi when you're on. If you're watching on the replay, make sure you hit replay. Without further ado, Kelly, take it away.
All right, I'm going to go ahead and share. There, can you see my screen okay, Carrie?
Let's see. Yes.
And are we staying on or?
Nope.
Okay. Thank you, Carrie, for giving me this opportunity. I want to say hello and welcome to everyone that's watching or listening. And it really is my pleasure to help you learn more about small intestinal bacterial overgrowth, or SIBO for short. Let me go ahead and move to the next. It's not working. There we go. So just to help you know a little bit more about me, I am a fully certified health coach. I have specialized training in the digestive system and gut health. Plus, I do have completed a SIBO mastery program. So I'm well versed in SIBO. But even with all my education and experience, one of the key factors I think really qualifies me to help others is that I can relate. I have suffered myself from a multitude of health conditions over the decades, and so I do understand the challenges of suffering, both physically, emotionally, and mentally. And I also have suffered with SIBO. So it is one of those things that I'm very familiar with, and very familiar with the frustration that comes with it. Now, when it comes to SIBO, let's face it, GI doctors and even naturopathic doctors can get very perplexed by it. It can be quite complex, and we're going to talk about the complexities of it. Most are just not able to help with those with SIBO because of the complexities of it. And so they end up still struggling and going from doctor to doctor and practitioner to practitioner. I do have such a great passion to help others have freedom from SIBO and ongoing health struggles that are associated with it. So I appreciate the fact that I can educate you more and help you be more informed about it, so that you can make wiser decisions as it relates to your situation. I absolutely believe it's possible to overcome SIBO, and in some cases, we'll talk about it, there is relapse possibility, but there's also a way to manage it in that circumstance too. I'm one of the relapsers, so there is a way to manage it. I do understand how frustrating SIBO can be, and that it takes time to get rid of it. So I'm going to go ahead and get started, and I want to, in this time together, I want you to understand the what is SIBO. So let's talk about, help you understand a little bit more what SIBO is. And we're going to look at how to tell if you have SIBO. It's one of those things you don't want to guess at, because knowing if you have it and what's going on around it is going to help you determine the right steps to take in order to overcome it. We're going to go through the symptoms and conditions that are associated with SIBO and all the risk factors. We're really going to get into the risk factors and underlying reasons for SIBO. And then we want to talk about what you can do about it. And I'm going to include some actionable steps that you can take now to help you with your symptoms. Now, small intestinal, I've got to move, there we go. Small intestinal bacterial overgrowth is, we're not talking about pathogens or necessarily an infection. It's bacteria, even good bacteria, that get into our small intestine, but they're not supposed to be there. We do have some bacteria in our small intestine. The majority of it is in our colon. And when we get excess of the good bacteria in our small intestine, that's when it becomes SIBO. Now, an estimated SIBO causes 60 to 80% of IBS. So the majority of people with IBS do suffer from SIBO, and a lot of the symptoms are very similar. And there's an estimated 500 million people worldwide, and 10 to 15, which is 10 to 15% that have SIBO. That's a pretty significant number that are suffering. Now, what I do want you to understand is that SIBO is a symptom too. It is sandwiched in with other things. So what I mean by that is that SIBO results in symptoms, but it's also because of other things going on. So SIBO might be a cause of your symptoms, but it's not the root cause. There's actually root causes of SIBO, and we're going to talk about those. And I guess approximately 50 to 60% of people who have SIBO struggle with relapse, and that's also pretty significant. So we want to talk about the fact that there are some folks like myself, because of certain issues, are going to continue to relapse, and so we have to manage it, and there is a way to manage it in order to not continue to suffer. So is there any way to know for sure without testing? And I know we don't always want to just say, we got to test, we got to test, we got to test. But the fact is that no, there is absolutely no way to know if someone has SIBO without testing. And the best test is breath test. Now, I do want to say, if you're familiar with the organic acids test and other stool testing, even comprehensive stool testing, there are certain markers in those testing that can give a red flag to SIBO, but none of them can fully let you know if you truly have SIBO without doing the SIBO breath test. And then the result possibilities for SIBO are, you can be hydrogen dominant, methane dominant, or hydrogen sulfide. Now, the test that is currently out there today can only determine hydrogen or methane. It cannot determine hydrogen sulfide to the full extent, which we won't be able to get into all that. But it is suspected that sometime this year they'll be testing specifically for hydrogen sulfide. Now, with the remedies varying by SIBO type, this is the reason why testing is so important. It depends on what type of SIBO you have as to what the remedies and steps that you're going to take in order to actually overcome it. And the other important thing to understand is that there are varying remedies, and there isn't any one specific remedy that is going to work perfectly for each person. They can vary. The effectiveness of different remedies can vary by person. And even highly skilled practitioners can get very overwhelmed with SIBO because it takes a while. There's a process. There is a process to actually overcome it. It's not just a couple months of treatment most of the time, and because it can relapse. So there's just there's so many factors involved, so many underlying things involved in SIBO. It can be very complex, even for skilled practitioners. So let's take a look at what's happening with SIBO. So what's happening is that there's an overproduction of gases in the small intestine with SIBO. And what occurs is that carbohydrates feed the SIBO, they feed the bacteria, and then they give off certain type of gases. And carbohydrates meaning certain prebiotics, certain fibers. are what is actually triggering, because fiber actually can be a very good thing. It can feed our bacteria and nourish our bacteria. However, the problem resides is when we have too much bacteria in the small intestine, it produces a particular gas, either hydrogen, which causes certain types of symptoms and problems and is treated differently than what produces methane. Now, what produces methane are bacteria, well, they're actually not bacteria, they're organisms called archaea, and they produce methane. So this process that's going on between hydrogen, archaea, and methane, and then also hydrogen sulfide that can be produced by hydrogen, this is all the complexities of the gases that are going on because of SIBO. And the fact is that the bacteria or the carbohydrates that are feeding the SIBO are not producing the methane. What's producing the methane is hydrogen. So it first starts off as hydrogen, and then it could either lead to hydrogen sulfide problem, or it could lead to the production or feeding of the archaea that then produce the methane. So again, it's a little bit of a different complexity, but this is what's happening. And again, as we talked about, the only test that can fully detect SIBO is the SIBO breath test. So now I want to talk about symptoms and associations with, or conditions that are associated with SIBO. This is a very, if you look at this is a very long list. And as you can see, there's a lot of issues that are resulting inside the gut, but there's also a number that can happen outside the gut. So we won't go through each one of these specifically, but for the inside the gut, of course, we talked about SIBO being highly related to IBS. It's also highly related to diverticulitis. But then these are the symptoms that constipation and diarrhea are alternating between them is very common. And then the rest of these symptoms inside the gut are also very common. Leaky gut is very prevalent with SIBO, and then of course nutrient malabsorption. And when we take a look at what's going on outside the gut, these conditions are highly associated with those that have SIBO. So hypothyroidism, which is most hypothyroidism is caused by the autoimmune condition called Hashimoto's, which I have. That's one of the autoimmune conditions actually that I have. And then there's another outside the gut that's going on is aches and pains. And a lot of those with fibromyalgia actually have SIBO. And that was a question that we had. So yes, fibromyalgia is highly associated condition associated with SIBO. It also causes other problems like weight problems, autoimmunity, food sensitivities, and intolerance are extremely prevalent with SIBO. And then, of course, you can see the rest of these. So there's a number of conditions that are associated with SIBO. But I really want to get into the risk factors and the root causes, because this is what is going to be so critical in order to address. And most of the time, folks that are suffering with SIBO have varying degrees of severity in these areas and a combination of these underlying conditions that are the root cause of their SIBO. So we have to, there's so many different remedies, and that's why it's so important to work with someone or to be very knowledgeable while you're going through the process of trying to identify root causes and risk factors, if you do want to get to the underlying reasons. So the first one I want to talk about is reduced digestive secretions. And digestive juices or digestive secretions are the enzymes, right? The enzymes that we need to digest our foods. The stomach acid that we absolutely need to digest our foods, besides kill pathogens that come in, help us to absorb nutrients, and so many other benefits that we need stomach acid for. And then bile. And the bile, of course, is produced by our liver, stored in our gallbladder, and then enables us to digest our food, especially our fats, better. And fat malabsorption is very common, along with low stomach acid all very common with those with SIBO. So you definitely want to think about those. And the other, or the next risk factor is a microbiome imbalance, or you may have heard of dysbiosis. So this is where there's an imbalance of good and bad bacteria. The fact is we all have both good and bad bacteria. We're never going to get rid of all the bad bacteria. That is not the point at all. The point is to have a balance of it, because if we have enough of the good bacteria, it can outweigh any of the problems that the bad bacteria can cause. So it's real important to make sure that we have a good balance of in our microbiome. And then the other is pathogens and infections. And this is what I mean by there's certain parasites, there's certain bacteria overgrowth outside of SIBO, and like Candida, for instance, different fungus and other pathogens and infections that can wreak a lot of havoc in our gut. But again, there are some pathogens and infections that we don't necessarily have to treat in and of them by themselves, because our bacteria, if it's our microbiome is healthy and our gut is healthy, it helps to stave off any kind of problems that those pathogens are causing. It's when things get out of order that these particularly cause problems. And so this is something that when one has SIBO, we want to address. Now, one of the absolute biggest factors in a lot of people with SIBO is motility. Oh, I'm sorry. Oops, sorry about that. Is motility problems here. And we have motility in two functionalities. We have the peristalsis, which is when we're eating food and the mechanical efforts that are taking place to move that food through our digestive system. And then the other motility comes with the MMC, which is migrating motor complex. And this is when we're in a fasting state, or within, it begins actually about an hour and a half to 2 hours after we stopped eating. And one of the biggest challenges with SIBO is when one has the MMC dysfunction, or migrating motor complex dysfunction. This is when, because during this time, it's kind of like, it's the motion through our digestive tract of our body sweeping through the debris and bacteria and things through our system in a fasting state that needs to happen. And what happens when we have dysfunction with the MMC is that bacteria get stagnated in the small intestine. And when that happens, it just wreaks havoc. And that's what contributes very highly to SIBO. So one of the things that we'll talk about remedies on how to manage the motility problems that happen, that are a huge majority of problems. And then the other is structural issues. And this can happen from surgery, from infection. It can create blockages, adhesions, scar tissue. If someone's had gallbladder surgery, or they've had their hernia, if they've had hernia surgery, or they had C-section, for instance, or their appendix out. Me, for instance, I had a serious, actually very life-threatening infection when my appendix burst. So even just one surgery or one infection can cause structural problems. But if you've had multitude of these, this can create a very significant problem in our GI tract, and it also contributes highly to SIBO. Now another, and this is a big one, is nerve cell damage from history of food poisoning. They have recently come out with a test. It's called IBS SMART test. And there is now an autoimmune association with IBS. If someone has had food poisoning, there's a bacteria that's given off with that can damage the nerve cells with our migrating motor complex, and that sweeping mechanism, again, that we talked about. And with that, it can become an autoimmune issue, meaning it remains. It's not something that goes away. Now, the severity can be changed, but it is, this is one of the things that I suffer with. I actually have an autoimmune component to this because of previous history of food poisoning more than once. And so if you've had a history of food poisoning, this can contribute also to SIBO. The other item that is a high risk factor is damage to the mucosal lining and small intestinal barrier. So that can also contribute. Now that damage can be repaired. The cells in our digestive tract can absolutely be repaired, but you have to go through a process of doing what needs to be done to repair it. Highly associated with leaky gut, with SIBO is leaky gut and diverticulitis. Now, diverticulitis, not everyone necessarily gets rid of it completely, but it is absolutely manageable. That is also something that I've suffered with, and I've also had a colon resection because of that. And I've also suffered with leaky gut and repaired that. That can absolutely be repaired, but it is something that must be addressed. If someone does things to address SIBO, but doesn't manage the leaky gut and repair any GI damage and inflammation going on, the SIBO is definitely going to keep coming back. Another item that is a risk factor is medications. There's certain medications that contribute to, to problems with, we won't go through all the different medications, but there are certain like PPIs, opiates, and other prevalent, NSAIDs, which are the non-steroid anti-inflammatory, like ibuprofen, if someone takes those significantly. So there's a number of medications that can contribute to GI problems and that then contribute to SIBO. Now, the one thing that I want to mention, which is a huge influence on SIBO, it's a trigger, but it is not a root cause. It's not a root cause to really almost anything, but it is a huge trigger, and that's stress. And then stress can be in the form of anything, whether it's physical trauma, any kind of physical trauma whatsoever, whether it's something that, we wanted, like elective surgery, or whether it is being in an accident or injured in any way. But it also is any kind of emotional stress. Anytime that our body is in a chronic state of fight or flight mode, for instance, that stress is going to cause flare-ups in the problems that we have. So a lot of people probably notice that when they're going through a lot of stress, their symptoms start to get worse. They start to have more flares with their autoimmune issues, things like that. That's very, very common when it comes to stress. So very important to manage our stress. So one of the things that you'll hear from me over and over, if you watch me, listen to me, or if you're a client, is that we want to identify and address the root causes, right? That's going to be the wisest solution. And it's going to bring the most sustainable freedom from overcoming, from suffering and overcoming any kind of issues that you're dealing with, especially SIBO. So the fact is that we don't want to chase. You can see the visual there. We don't want to chase our symptoms, and we're just constantly, oh, I've got this problem, I'm going to take this for that. I've got this problem, I'm going to take this for that. We do want to identify the root cause. But what I clearly want everyone to understand is that it is absolutely okay, and it's very important to still tame down your symptoms and work on managing your symptoms so they're not so intolerable and so forth while you're investigating the root causes. And sometimes while you're managing and treating your symptoms, you can also be at the same time simultaneously working on root causes. So in no way would I ever say, just focus on root cause, don't deal with your symptoms, because there's no reason why anyone should have to deal with misery while they're trying to work through the process of uncovering underlying reasons. And I do want to make it so clear that you can have freedom from your SIBO. You can feel healthy and confident again. You can get back to doing the things you love. We know that SIBO and the symptoms can sometimes keep us from making commitments, keep us from being able to do the things that we enjoy doing. And it is absolutely possible to enjoy your life without your health holding you back. So I do want to make that very clear. I have numerous autoimmune diagnoses, and SIBO is yet another issue that I've suffered with, and I do have a very strong quality of life because I have managed it well, and I don't like my health to be a limitation to my life. So I just want you to know that it is possible to overcome. So let's take a look at the big picture action plan. Whether you, and I'm all for a DIY, meaning do it yourself. So whether you're do it yourselfing or you're seeking an expert, SIBO is very complex. And if you've been doing any kind of research or seeking out information about it, you can tell that it's quite complex, and there's a lot to it. But I'm all for doing it yourself. I'm one of those that does a lot of research. I do a lot on my own, and it's not until that I get stumped that I seek out an expert, and SIBO is one of them. And again, what's most important is if you are unsure, do the SIBO breath test. Very important. If you need access to that, let me know. I can get you access to that. And the other issue is that the triage approach with symptoms. And what I mean by triage approach is we all know what we do when we have a broken bone, right? You go to the hospital, you get it fixed. That's a triage approach. That's managing an acute situation. When we have SIBO, it becomes more chronic. But what I mentioned before is that it doesn't mean you don't want to take a triage approach to your symptoms, but at the same time, you don't want to stop there. What you want to do is look beyond your symptoms and identify the root causes so they can be addressed. But again, important to know that while you're managing your symptoms and you're doing remedies for your symptoms, you can also be simultaneously working on understanding the underlying reasons. So next I want to go through the remedies and support, and I'm going to talk a bit about these. The remedies and support that are oral or that you're going to take internally. There's a lot of them. And again, this is why it's very complex, but they all touch on various different things that can be triggering this and causing the SIBO. Some people think that a diet might be the only I guess, that the end all, for instance, because when they work on a specific diet, and we'll get into it in a little bit more, that they have relief from their symptoms. But the fact is that a diet alone is not going to take away the SIBO. It may give you symptom relief, and that's absolutely fabulous, but it's not going to take away the SIBO. The other item that we'll look at is probiotics and prebiotics. We're going to also take a look at antimicrobials, whether those are natural or whether they're prescribed medications, or a combination of. It can be popular. Biofilm disruptors, so we're going to talk more about biofilm. And prokinetics, now these are the things that are going to support the motility that I talked about. They can support both the peristalsis, which again is when we're eating, and the mechanical action of moving the food through our system, and also the migrating motor complex, which is when we're in a fasting state, and it's kind of the housekeeping or sweeping, if you will, during the time that we're in a fasting state. We're also going to talk about digestive aids and intestinal barrier repair, right? So we can heal the leaky gut, and also binders. Binders meaning, well, we'll get more into the binders. But before we get into that, I wanted to mention other remedies and support that are going to be important too. And these are more that are going to be handled topically or externally and manually and so forth. And the first one I've got listed here is mindset and emotion balance. This is so important because number one, it helps us to go into the the sympathetic state, which is the rest and digest, because we want to make sure that we're not in fight or flight mode, we're not constantly stressed, and that we're doing things in order to manage our stress and also to have a positive mindset are able to have a stable emotional balance. So that's super, super important. And activities for stress management in the parasympathetic state, again, which is that fight or flight stress state, are meditation, mindful diaphragm breathing, EFT, which is emotional freedom technique, DNRS, which is a brain therapy, visual and mental, not anything invasive, hypnotherapy, hydrotherapy. These are all the kind of things that can help with stress management. Acupuncture, for instance. Another element that is going to be very important for the migrating motor complex and that whole motility effort and the vagus nerve in our gut is visceral manipulation or other manual physical therapies that are literally, you can do some things yourself. So you can certainly look up all these things on YouTube and check these things out. And then other activities that can stimulate the vagus nerve, you know, even gargling, for instance, or splashing your face with cold water can actually stimulate your vagus nerve. So there are different various activities that you can work on, and if you just look these things up, you'll see a number of different things that you can do in this particular arena. But now I want to get back to explaining the internal remedies, or things that you're going to consume for internal purposes more clearly. So when it comes to dietary nutrition, so the basics, of course, for anyone, including those with, and especially those with SIBO, is that we remove inflammatory foods. Of course, like we want to have a whole food, nutrient-rich dietary plan while we're avoiding processed foods. We want to consume healthy fats instead of the unhealthy fats like unhealthy vegetable oils. And we want to consume quality protein. That is a foundational for really just about anyone. But when it comes to SIBO, because of what's happening in the small intestine and the gases that are being promoted there, there is some very specific SIBO dietary plans. And some of these work better for others versus, you know, some versus others. So a lot of times this is going to be trial and error. And these are not, I want to make it clear, these are not meant to be on long term, because anytime you have a more restricted dietary plan for longer term, you end up restricting your body of specific types of nutrients and processes, and that could then take you into another problem. So it's very important to understand these are not for long-term purposes, but the low FODMAP diet is a very, very popular. And FODMAP, it's very long, but it stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So there are a number of different types of carbohydrates. So low FODMAP diet, SCD, which stands for specific carbohydrate diet. The bifastic diet, which I love. The bifastic diet is a combination really of the low FODMAP and the SCD diet, but it also has a phased approach in it. So I really love the bifastic diet. Elementa diet, which is a more liquid diet for just a few weeks, 2 to 3 weeks, with specific nutrients in it. A low histamine, and low histamine is more to deal with the symptom. A lot of folks with SIBO are intolerant to histamine foods or histamine liberating foods. So a lot of them have to also be on a low histamine dietary plan, again, short term. And then there's other items that many people become intolerable to, like salicylate and oxalates and things like that. So intolerances and food sensitivities are very prevalent with SIBO. And of course, you want to avoid anything that you're sensitive to, because that's just going to add fuel to the fire, and it's going to continue with the chronic inflammation. Now, when it comes to probiotics and prebiotics, some of the things that I want to mention are that most people cannot tolerate regular probiotics with SIBO because they give off, one of the big reasons for that is because regular probiotics give off histamine. And again, histamine intolerance is very prevalent with SIBO. That was something that I also suffered with. So spore-based probiotics, not soil-based, They're very different. I know the term spore-based and soil-based is used interchangeably a lot, but spore-based probiotics is very common and helpful with SIBO. And my favorite is Megaspore Biotic. That's the one that I take. And then certain strain-specific conventional probiotics, because as I mentioned, many have problems with regular probiotics, but there are some specific strains that can be helpful with SIBO. Now, Saccharomyces boulardii is a yeast, but it functions as a probiotic, very helpful with SIBO. And then when it comes to prebiotics, people with SIBO can be very intolerant to them. There are certain prebiotics that can work for some better than others. And in some cases, when someone is doing antibiotics instead of natural antimicrobials, there's certain prebiotics that can work very well in combination with a certain antibiotic. Now, when it comes to antimicrobials, the prescription antibiotics are usually 10 to 14 days at a time, usually not done more than a couple rounds or so. And one of the most common is rifaximin or Xifaxan. It's also, I want to make this very clear, because a lot of people that want to stay, think of antibiotics that it can be very harmful for the gut and they kill off our good bacteria. All absolutely true. Not true with rifaximin. It's actually considered more a eubiotic because it goes straight to the small intestine and it hits the bacteria there, but it doesn't kill off all the other good bacteria. So that's why this is such a prevalent antibiotic. It can be very, very expensive. So a lot of people go to Canada to get their prescription filled. And this is one of those ones that I was talking about, that it can be very effective with the prebiotic called PHGG. But the fact is that you don't have to have an antibiotic to overcome SIBO. Antimicrobials, natural antimicrobials work very well. The time on these, though, for rounds of treatment, for instance, are 4 to 6 weeks at a time for the natural ones. And you want to alternate. Most have to do more than one round. I had to do numerous, but I alternated each time so that you're not doing the same thing each time and your body's not gotten used to it. And these are various different natural antimicrobials. This is not an exhaustive list, but these are very prevalent. And as I previously mentioned, it's very important to know what kind of SIBO you're dealing with in order to know which one of these particular remedies are going to work best. And then there's a combination. These are specific different combinations, some example of combination products with some of these natural antimicrobials in it. And you can go back and we won't go into each one of them, but you can certainly go back and rewatch the video to look at those and then do some research. Now, biofilm disruptors are very important. Biofilms it's a collection of microbes that adhere to the outside surface as a protective coating. Which in some cases can be a good thing, but when it comes to bacteria you're trying to kill, it's not so good. And it's on virus, it's on parasites, it's not just on bacteria. But when taking a biofilm disruptor, it helps to allow the antimicrobials that you're taking to actually penetrate that biofilm on the outside of the bacteria so those antimicrobials can get in and do their job. Biofilms are heavily resistant to antibiotics. So that's why natural antimicrobials are just as, and sometimes even more effective than antibiotics when it comes to SIBO. And these are just some examples, again, some examples of biofilm disruptors, and you can alternate with these. Some work better than others for different people and so forth. Now the prokinetics, very important for the motility that we've talked about. There's prescription prokinetics and there's also natural ones that can work very well. Prokinetics is probably one of the most important things that if you have SIBO and you suffer with relapse, it's likely you want to take prokinetics like ongoing. And these are just, again, some of the examples from a prescription standpoint and from a natural standpoint of different items and different brands of different prokinetics. When it comes to digestive aids, of course, you can take digestive enzymes. One of my favorites is Enzymatica Digest Gold because it's extraordinarily comprehensive, has great dosages in it. Stomach acid support. Now you can do this through bitters and ACV, which is apple cider. I put AVC. It's actually ACV, apple cider vinegar. Excuse me. And that actually can stimulate your and encourage your body to create that stomach acid when you're eating. However, some people like myself actually still have to take some betaine HCl with pepsin. Make sure it's always with pepsin. Directly with their meals, especially with protein, to help support stomach acid or low stomach acid. And bile acids, there are certain items you can take directly the bile acids. Usually it's a product called Ox Bile. There's a couple of different brands. I use Seeking Health and what's the other one? I can't remember the other brand that I use. But milk thistle, dandelion, curcumin, they're actually items also that you can incorporate that can help stimulate the bile. Now, when it comes to intestinal barrier and gut repair aids, this is where, and there's a number of items on these slides, so we're not going to go through everyone in detail, but again, you can go back and watch the video so you'll have this information. Immunoglobulins has been a huge game changer for me. But there's a number of other items. I love the Microbiome Labs product. The Mega IgG 2000 is immunoglobulin, and then they have some other fantastic products. And these are also some individual items that work very well to help support the gut and leaky gut and gut repair. And binders, now binders are specifically, as I mentioned here, they basically help the body absorb toxins or mop up the toxins to avoid circulating and making you sick. A lot of people, when they're treating different conditions, they feel sick for a few days after starting some new supplements and new treatments and remedies, and that's because of potential die-off effect. And so when pathogens or bacteria are dying off, they release toxins, and the binders help to actually absorb those toxins. So these are some of the particular binders. Also very important when it comes to binders, take them at least an hour, if not 2, away from any medication, supplements, and food so as not to bind up your nutrients and inhibit absorption of those other items. Now, when it comes to investing on your own, do it yourself, you want to just be very wise and strategic about it, right? Because we can see how complex it is. Different things work differently for different people. And so important, don't just try one thing and give up. If it doesn't work, try something else. There's so many different things. One of the benefits of working with a practitioner is they can help guide you in different things to try and help you through that process. Don't just give up, right? As we talked about in managing your symptoms, you want to get to the real root cause, but you can be working on that simultaneously. Do not sit in misery because of your symptoms. And then you want to learn about all the many remedies and modalities. So make sure you do your research. And I provided here a list of experts that are in the field that if you just look up any one of them, or you can look up all of them, do your research. Some of them, like Dr. Jacoby, Dr. Seebecker, they actually have some patient videos and tutorials and things like that. Some are free, a lot is free actually, and then some are paid for, where you really get some great education on your own. And then there's a great Facebook group called SIBO SOS Community. I highly encourage you going into that. It's not my group, but it's one that I've joined, and it's very large, and there's a lot of information in it. You can ask questions. They have a lot of material, provide a lot of support. So I highly encourage you to take a look at that. Now I'm going to go through a couple of slides of specific but very common GI symptoms with SIBO. Many have various number of these. I'm not going to go through every product here, but I wanted to provide the slides so when you can go back and look at the video, you have this information and you can start probing and doing your research, and this enables you to be much more informed about it. So we have constipation here, diarrhea, GI aches and pains. These are all the different number of things that are remedies that can help tame down these symptoms. And again, working with a practitioner can help too. And then, of course, we have the gas and bloating, nausea, heartburn, acid reflux. These are the various different items that can help with those particular GI symptoms. So there's a lot of different things available. Sorry about this. I think I have an issue with my slide. So I just wanted to mention that I always tell my clients, I tell everybody, right, that progress takes time. We have to be patient. And with SIBO, can be a long, drawn out process sometimes for many people. And as I mentioned, there's relapse, but you can overcome. I just want to make that so clear that you can overcome. And it is a journey, it is a process, but it doesn't have to be straightforward, right? As you're moving forward on your journey, you will be making progress. It just takes time. You're going to have some days where you're just slumped over and you are so frustrated and you are so suffering. And then you're going to have moments or days of time where you're just rejoicing because things have gotten a lot better. And I have to say, you're going to fluctuate. You're going to fluctuate greatly during your process and journey. So just know that that is very normal. It's very normal. But also know that when you're willing and ready to actually do the work and take the journey, it is possible to have freedom from your constant struggles. I'm living proof. My husband has also suffered. He's proof. And my clients and many others are proof that you can overcome SIBO. There we go. So we want to be sure and provide answers to your questions. So please send in any questions you have. I know some of you might be on Facebook now with some questions. You can send the questions if you want to either Carrie or me, or our email addresses are here. Maybe put SIBO questions in the subject line. It's just so important. What I love is to educate people so you're informed, you're more informed, better informed to make healthful decisions and to start doing your research. And if you need a practitioner, I'm here. There's many other wonderful practitioners out there. Reach out. We want to help you. And so I applaud you for even watching this, because that means that you're seeking more and you're already on a journey to investing in your health. So Carrie, I'm going to go ahead and stop sharing. So Carrie, I don't know.
Yeah, Kelly, if you just want to start your video.
Yeah, it won't unstop. You stopped it. There we go.
All right.
Love this technology stuff, don't you?
Yeah. We're doing pretty good, I would say. Well, ladies, that was jam-packed full of information, so much good stuff, and my mind is spinning. I'm not a SIBO expert, so I was super thrilled that Kelly decided willingly, very willingly, to jump on and present this amazing class for you guys. I really loved not just the details and the information and the in-depth that you went with the diet and the medications, the natural, the antibiotics, but also I wanted to encourage you guys that remember that health does take time. And I know there's lots of you in here that are very discouraged and feeling like you're struggling or you're with a sense of overwhelm. And if you suspect that you have SIBO, or maybe you've been, you did the breath test and you have tested positive for it and you're just kind of struggling to do it on your own, I really encourage you to reach out to Kelly. I personally don't take SIBO clients, but Kelly does. Is that right? Right? Still? Okay.
I do.
I thought that was the case. And so I'm going to leave her information here in this group. We're going to pin it in this video. We're going to, I'll do a post later with her information. And if you are struggling with SIBO, I really encourage you to reach out to Kelly. As you can see, she's a wealth of information, and she's also personally dealt with it herself, which is something to be said and is just adds a whole nother level of support that you can get when you work with a practitioner who's been through some of the issues that you have. Monica, thanks for watching. Sherry, Flippa, I appreciate you ladies jumping on. Monica says, thank you. That was great information. So thank you, Kelly. If you guys have any questions, you can either leave them in the group and I'll get them to Kelly, or you can email Kelly or myself. And once again, I'll put her information. You can check out her website, check out her Facebook page. And thank you for tuning in, ladies. I know this is a little long, but we have so much good information to share with you, and we're just blessed that you decided to hop on, and hope you all have a beautiful evening. We will talk to you next week, and yeah, talk soon.
Bye, everyone.
Bye.